Hey guys, my name is Natalie and my group chose to do cerebral palsy with swallowing disorder. My group members are Bailey and Miles. So what is cerebral palsy with swallowing disorder? Well, to start off with, cerebral palsy is typically diagnosed in early childhood and continue throughout one's life. CP is a clinically diagnosed condition which causes functional and activity restrictions due to neurological and motor issues. So the neurological damage includes parts of the brain that controls movement, balance, and posture. And then due to the decreased tongue function is when swallowing becomes an issue. So this affects the bolus transport, which can cause hazardous swallowing or aspiration, reduce pharyngeal motility and drooling, and it can limit dietary intake, which can lead to malnutrition. So the signs and symptoms of CP with swallowing disorder include spasticity of muscles, impaired motor organization and functioning, deficits in sitting, standing, locomotion, and daily living skills, decreased tongue function, excessive drooling, difficulty swallowing, and aspiration. So the statistics that I found, the first study had a little over 23,000 participants, mostly being children, but the range was birth to 79 years old. Overall, 50.4% of people with CP do have swallowing disorders. This can lead to an increase for malnutrition, like previously mentioned, and dehydration, aspiration, pneumonia, and poor quality of life. So the second study was done with preschool-aged children, so 3 to 4 years, and it found that almost 2/3 of children with CP have swallowing disorders. They also found that this leads to stressful meal times for both parents and children, which could cause the children to not like to eat if it's like a big ordeal, or if they have like a negative effect with eating, which can also lead to that malnutrition aspect.
So I'm going to be talking about some of the diet specifics that are necessary for a child with cerebral palsy with swallowing disorder. Most of us have never considered the ability to chew or swallow food a privilege, but after I looked into cerebral palsy with swallowing disorder more, I myself realized just how big of a privilege it truly is. Foods must be thoroughly chewed to prepare to be swallowed and digested, which can be very difficult for someone with CPSD. Medical professionals typically recommend non-surgical treatments as the first step to help with swallowing problems, but can later on recommend surgical treatment options as well. Children can receive treatment at some of the following places listed below. So acute care centers, clinics, hospitals, and home settings, long-term care facilities, physicians' offices, and rehabilitation centers. The types of non-surgical interventions that are typically recommended. First is change in food or liquid consistency. So foods can sometimes be too solid and liquids can be too thin, which can aggravate the child's ability to swallow successfully. So physicians will typically direct parents and caretakers to puree solid foods or cut them into smaller pieces to change the texture of them. And then liquids are recommended to be thickened because it's easier to control in the mouth. So the typical consistency that they recommend is what you would see like a smoothie in. Chin tucking, it's a positioning for the child to help control the mechanism that affects the swallowing. So you position their head in a certain way with a tucked chin. And it's found to be very helpful to prevent the likelihood of food entering the trachea when they are swallowing, which in turn helps to prevent choking. Encouraging chewing. So all children have the tendency to underchew their food and end up choking, especially children who have a swallowing disorder. So this is a topic that is typically talked about during speech and language therapy or during occupational therapy, and muscle exercises, specific exercises that are typically prescribed by the speech and language pathologist or the occupational therapist that are used to strengthen the muscles when swallowing. The types of surgical interventions. The most common is feeding tubes. So if a child's condition does not improve after the dietary changes or after the non-surgical interventions, it can be necessary to install a feeding tube. And this is just to ensure that the child is getting proper nutrition necessary for their bodies to thrive with full potential. So a feeding tube is placed into the stomach and it bypasses all the functions of the mouth and the esophagus, which eliminates pretty much all of the challenges that come with swallowing. You can also surgically excise the esophageal sphincter. So the sphincter is cut to relieve pressure caused when it cannot relax, and it can help with a child swallowing and not having regurgitation. And then the other surgical intervention is removing obstructions. If there is a physical defect or obstruction on the pharynx, it can be surgically removed. And two things that are most common to see are strictures and rings. They can develop over time and can be removed through an endoscopy. Helping your child cope. So teach your child to enjoy their meals. Once your child is at an age where they can pick and choose their meals, parents can encourage slow eating. This helps children who have developed ambivalence about eating understand the troubles they have can be controlled. And understanding the dynamics of feeding means parents are less likely to rush their child through meals and understand that their child has a need for a slower pace when eating. A feeding tube. A child with a feeding tube needs to be reassured constantly that the tube is there to help them stay involved in their day-to-day activities. So helping your child understand the role of their feeding tube helps them to feel less self-conscious about it. And then proper guidance. Parents should really meet with their speech language pathologist and a registered dietitian to gain the proper understanding and guidance for meal planning and preparation, dietary recommendations, exercises, positioning rituals, and feeding techniques. So the speech language pathologist and the dietitian is going to be the person or the people that will give you the specific foods that a child with CPSD needs to have, the exercises they should be doing at home, how to position their head to prevent choking, things like that, that are just setting the parents and the child up for success to prevent choking at all costs. The most important nutrients that a child with CPSD needs, it's pretty much all minerals and all minerals that play a role in bone growth. So calcium is the number one. It is a mineral stored in bones and teeth. The best sources for calcium come from milk, yogurt, cheese, and calcium fortified juices. Vitamin D, it helps the body absorb calcium from food and supplements, and it can be found in some fish like salmon or tuna, fish liver oil, milk, orange juice, and cereal. Phosphorus, it's a mineral that plays a role in growth of teeth and bones. It's found in milk and milk products, meat, fish, eggs, poultry, nuts, seeds, and whole grains. And then other important minerals and vitamins, vitamin C, vitamin K, magnesium, copper, zinc, and manganese.
When testing for cerebral palsy, generally you are doing developmental screening tests. These are done when they are first born, at 9 months, 18 months, and then again at 24 to 30 months. This is so they can check up on their developmental skills and to make sure that they are progressing as they should. If they notice a child isn't progressing as far as they should be, a physician or specialist can recommend they get a medical test such as brain imaging, which is like an MRI scan, ultrasound, CT scan. They can also do lab tests, which will be blood work, urine, or cerebral spinal fluid. And when you're doing these tests, generally you're trying to rule out other possible disorders, just to narrow it down to cerebral palsy itself. All in all, when testing a child for cerebral palsy, a specialist will be coming in to do a physical exam. They'll also come in to talk to the parents about the child's birth and development, and they will also do checks on their child's strength and ability to move. When diagnosing a child with CP, it sometimes can happen as soon as they are born, but generally they do not actually get diagnosed until they're about the age of 2 or older. And that's why it's so important to kind of just keep an eye and make sure that they're developing as they should at an early age. Getting a diagnosis is very difficult because a lot of the symptoms are very similar to a lot of other disorders. So when doing diagnosis, it does take a few steps. The first step is monitoring. This is just checking up on your child's growth and development over time. A doctor can do this by just checking with the parents, also by following up and asking about if they have any concerns about their child's development, any updates on developmental history, anything they should be aware of, and just being aware of their child's movements. If a doctor notices anything in that first step of monitoring, they'll move on to the next step, which is screening. Screening is checking for developmental delays and understanding exactly what they are falling behind in. Screening is essentially the same thing as when they do their testing. It's more just ruling out any other possible factors or anything else that could be mimicking the same symptoms and give the appearance that the child does have cerebral palsy. If after that they still notice something that gives them some reason to worry, they will move on to the next and final step, evaluations. Evaluations is when a doctor will begin to closely examine the child, really pay attention to their motor skills, muscle tone, reflexes, as well as their posture. And this is the point where they try to really rule out any other possible disorders. That way they can really narrow down and officially diagnose a child with cerebral palsy. Specialists who could do this type of developmental evaluation would include pediatrics, neurologists, psychiatrists, and rehabilitation doctors. CP is also hard to diagnose just because it comes in different degrees, to where the more mild it is, the longer it can actually take for a child's symptoms to really occur, or even just to be noticed in the first place.
So for the 5-day menu, I took days Monday and Tuesday. So to begin with, for breakfast on Monday, the child can have a fruit smoothie, which will cover the fruit and dairy aspect of the meal. So the smoothie consists of 2 cups of frozen mixed berries, 1 cup of Greek vanilla yogurt, 2 bananas, 1.5 to 2 cups of orange juice, 2 tablespoons of peanut butter, and then for the grains, they can have a half a slice of whole wheat bread and cut it into small pieces. So for the morning snack, they can have a half a cup of milk, a half a cup of applesauce, and 3/4 of a cup of puff cereal. And then for lunch, they can have 3/4 cup of milk. Their vegetable can be 1/4 a cup of baked sweet potato pureed, and their fruit can be 1/4 a cup of banana pureed or cut up, whichever suits the child the best. And then I combine the grains and proteins and done like a chicken noodle soup with half a serving of whole wheat pasta, and then 1.5 ounce of the pulled chicken for their protein. For their afternoon snack, they can have 3/4 cup of milk, 1/8 cup of granola, and they can mix that in with some sweetened strawberry yogurt. And then for dinner on Monday, they can have 3/4 cup of milk, 1/4 a cup of pureed carrots, 1/4 a cup of cinnamon applesauce. And for their grains, they can have a half a slice of toast cut up into small pieces and a half an ounce of grilled salmon cut up into small pieces, or maybe pulled up into smaller pieces as well. And then for Tuesday for breakfast, they can do 3/4 cup of milk. For their fruit, a half a cup of bananas cut up into small pieces or pureed. And then for their grains, they could do a half a serving of a biscuit cut into small pieces. For their morning snack on Tuesday, they could do a half a cup of milk, a half a cup of applesauce, and then a half of a scrambled egg for their protein. And then for lunch, they could do 3/4 cup of milk, 1/4 cup of green peas pureed for their vegetable. Then for their fruit, they could do 1/4 of a cup of pineapple pureed or cut up. And then for their grains, they could do a half a serving of a roll and cut that into small pieces. And then for their proteins, they can do 1.5 ounces of pulled chicken or cut up into small pieces, whichever is easier for the child. Then for their afternoon snack, they could do 3/4 cup of milk. For their vegetable, they could do 1/4 a cup of a baked sweet potato pureed. Then for their fruit, they could have 1/4 a cup of banana and kiwi pureed. So for dinner on Tuesday, I didn't like a vegetable soup with ground beef, so it will cover the vegetable and protein aspects. So it included diced carrots, chopped celery, a chopped onion, 4 peeled and cut potatoes, 1 15-ounce can of tomato sauce, 1 14.5-ounce can of crushed tomatoes, 1 15-ounce can of peas, 1 15-ounce can of corn, and 1 15-ounce can of green beans. And then there's just some spices added in. And then for their grains, they could do a half a serving of whole wheat crackers. And then to add in some fruit, you could do a half a cup of bananas pureed or cut into small pieces.
So for the 5-day menu, I did Wednesday and Thursday. For breakfast, my recommendation was 3/4 of a cup of milk, 1/4 of a cup of oatmeal, and half a cup of blueberries cut into smaller pieces. For a snack, I said water, 1/4 of a cup of plain yogurt, and half of a cup of mango slices cut into smaller pieces. For lunch, I said 3/4 of a cup of milk, 1/4 of a cup of green beans pureed, 1/4 of a cup of couscous, 1/4 of a cup of strawberries cut into smaller pieces, and 1/4 of 1.5 ounces of cooked tofu cut into small pieces. For a snack, I said water, half a cup of cherry tomatoes cut into small pieces, and a half an ounce of cheese. And for dinner, I said 3/4 of a cup of milk, half a serving of a wheat roll pulled apart, half of a cup of pureed bananas, half of a cup of pureed carrots, and 3/8 of a cup of mashed chickpeas. For Thursday's breakfast, I said 3/4 of a cup of milk, half a serving of a muffin cut into small pieces, half a cup of mashed banana. For a snack, I said water, half a cup of mashed cauliflower, 1/4 of a cup of kiwis cut into smaller pieces. For lunch, I said 3/4 of a cup of milk, 1/4 of a cup of steamed carrots, 1/4 of a cup of green grapes cut into small pieces, half a serving of whole grain bread cut into small pieces, and 1.5 ounces of chicken cut into small pieces. For a snack, I said water, half of a scrambled egg, half of a cup of orange slices cut into small pieces. And for dinner, I said 3/4 of a cup of milk, 1/4 of a cup of whole wheat pasta, 1/4 of a cup of pureed squash, 1.5 ounces of ground turkey, and half of a cup of applesauce.
And then for Friday, our last day, for breakfast, we're doing 3/4 cup of milk, half cup of blueberries, half serving of biscuit. For a snack, we're doing half cup of sliced strawberries and water and 1/4 cup of peanuts. Lunch we'll have water, 1/4 cup of broccoli, 1/4 cup of grapes, half a serving of a roll, and then 1.5 ounces of chicken breast. The second snack will be 3/4 cup of milk, half cup of orange slices, and then half cup of snap peas to give a little something extra, a little something different. And then for dinner, we're going to do water, 4th cup of rice cauliflower, 4th cup of avocado, half a serving of roll, and then 1.5 ounces of fish. And these are our sources. Thank you.